I'm Dr. Wiegand. I'm a reconstructive urologist at Orlando Health here in Orlando, Florida. I trained at the University of South Florida. I did a fellowship at Washington University in St. Louis. I've been in practice a little over 10 years. You know, I see a wide range of patients, but one of the main areas of my practice is urethral obstruction in men, most commonly caused in my practice by urethral stricture. This is a disease that most of the times we don't find a cause for, and it comes on very slowly, and men a lot of times don't even realize they have a problem until it becomes a major problem. And so I have to spend a lot of time explaining to men why it's an issue and why we're going to be recommending invasive treatments. Men think they have prostate problems, and the vast majority who think they have prostate problems do have prostate problems. But during the course of that workup, they're found to have a urethral stricture that probably came from some childhood injury, or they've had instrumentation in the past. They've had something else that they may not even remember. Men that have surgery for another reason, somebody tries to place a catheter, they can't get a catheter in. Or much more rare is complete urinary retention, where they are seeking emergency care. My discussion with patients, so honestly right now, I immediately begin to talk to them about why I'm going to recommend Optilume up front, right? And so most of the time, prior to 2 years ago when I had Optilume, before I had Optilume, I was explaining to patients who had been dilated repeatedly how more dilations had no chance of success, and how they needed to have a urethroplasty, and how I was going to take graft from inside their mouth and cut their penis open and repair it. And so that was a long and difficult conversation. Now I kind of start off by telling them this was the standard, but there's been a paradigm shift, and that the Optilume balloon is a form of dilation, but it actually seems to work. And so the data was compelling, I explained to them, and now that I've got 2 years of my own data that is really matching with what is published, there's no reason not to try an Optilume dilation first. And I stopped even saying try, because that makes it sound like it's not going to work. And I told them that kind of my standard of care now is an Optilume balloon up front, because it has the same chance of success as urethroplasty, but with almost no side effects. It's the low risk and least invasive nature. And so, you know, when I have these conversations with patients, usually what you're telling a patient with reconstructive options is we have the high risk, high reward, or the low risk, low reward. And what the conversation we have now is we have low risk, high reward, meaning you have the same chance of success, but with very little risk. It's a no-brainer. Nobody's choosing the more invasive option of urethroplasty in this instance. And so it's not, a lot of us men require convincing to have the procedures we need to save our lives. And in this case, it's very little convincing. We try to remain objective as surgeons, right? Because we want to share in the patient's happiness, but we also sometimes have to share in their complications. And so we try to be refrain from getting ever too happy or too sad. But to see a patient that was so miserable and have this basically very simple outpatient procedure that has this balloon that has an elegant design and an elegant concept, and it works, and they no longer are struggling to urinate. They don't have this fear. They've read about the urethroplasty online, and they're scared to death that's what they're going to be told they have to have, and then they have this other path, and it's successful. You know, they're happy with their urination, but it's also such a sense of relief, I think, for that patient, that they've been able to avoid something so life-changing.